Hi everyone, Rodelin TV here, live from United Kingdom, and I'll be discussing today on how to formulate or to make a nursing care plan. So I just finished my night shift. Before I sleep, I thought I would be dropping by just to give you a quick session and how to make a care plan. Hi, Babayan. So, hi, Sarah. Thank you for watching. So, this is our topic, a nursing care plan, obviously. So, that's part of my job as a nurse. Um, Once you identified a health need problem, then we have to create a nursing care plan. And for you out there, especially the nursing students or those who wants to become a nurse, this video is for you. But even though if you're not a nurse and you just out of curiosity, you just want to learn something, then please feel free to join me. And I wish this can help you a lot. Okay, so to start off, care planning is very, very important both in hospital and care home setting because this will be the very foundation of your problem solving. No, when your client, when your patient, or when your resident is expressing or a problem, a health need that needs your attention. Okay, so you need to discuss within the team once you identified a certain problem or a health need to one of your patients in the you call patients in the hospital. In the care home setting here in England, they call it residents or service user. Okay, and on a day-to-day basis, they will express either a certain level of pain, a and you will see signs and symptoms anyway. So this will be your cues. We call it objective. We call it subjective and objective cues. Subjective cues means these are um, the signs and symptoms that the patient verbalized or has expressed. For example, I got headache, and then or I'm having difficulty passing urine. So these are the things we call it subjective cues. Objective cues are the ones that you see physically, no, the one that you identified. For example, a an unusual mark on the skin, a sore, a wound, anything that you see are the objective cues. Okay, so care planning, there are steps on how to do it. So the first one, you have to identify the needs. Okay, so identification of needs. If the patient or your resident is able to express the need, then for example, I'm a patient or I'm a resident. Yeah, I will say to you, um, I'm constantly having sore on my throat, or I cough a lot last night. I think I feel so hot and I feel dizzy. So these are the needs, yeah. Or I'm having a terrible pain on my back, or I got a general body malaise or body pains. Okay, so these are the objective cues or subjective cues. This is how I feel. Yeah, this is how I feel. Thank you, Mary Kim, Mauricio, Sarah, and Ion for joining. So I hope you learned something from our nursing care planning today. So those are the needs, yeah. And then you can say that you can say on the first part that Rosalind is experiencing a terrible back pain, or Rodeline is having itchiness on her eyes or both eyes, no, and then you will carry on. So you will assess me if you're a nurse. So you will assess me from head to toe, or else or for the pain you can ask me what's the score from 1 to 10. What's the pain like, Is it stabbing? Is it what you call this one? Is it how long does it last? You know how intense it is, because there are several types of pain also. Yeah, so there's a lot more to explore. And then, or let us take an example, the very specific one, the COVID symptoms. Yeah, is there a continuous persistent cough? Then you will identify yes or no. No, and then is what's the temperature, the body temperature. So that means as a nurse you need to check, is there a loss, or is there a body ache or muscle pain, general body pain? Then that's one need as well. And then also, you check if there's developing loose bowels, or a what you call this one, um, I said about continuous cough, right? Loose bowels, loss of taste, yeah, or there are changes in the taste, and then obviously, your subjective cues or objective cues will be that I expressed a continuous cough, persistent continuous cough last night, and then the objective cues will be you check the temperature, it is 39, and then I'm shivering, I'm or my body is warm, and then suddenly I develop this, I do vomit and things like that. So it gets a bit complicated. Okay, so that will be your subjective and objective cues. So your care intervention, but before that you will set also a general objective. So your general objective will be for Rodeline to be attended straight away, or for Rodeline to be confirmed to be tested either positive or negative of COVID. Yeah, that's your objective. So the specific objective is to ensure that I will be pain free and comfortable, and to ensure, so I will be like a query, um, that I will be put into, that I will not be able to spread infection. Yeah, so it will be like I'm considered to be on a isolation. So your nursing, so that's your objective, to prevent cross infection or cross contamination, and then that's your specific objectives. Yeah, I told you about the subjective cues and objective cues. So, what will be your care interventions for me, because I'm having this um, cough, I'm having this body temperature, body malaise, pain all over my body, and I'm having loose bowels, and what else? My taste, sense of taste has changed. So, number one, for the continuous cough, so you need to check in my folder or in my mark sheet. Oh, number one is obviously you have to notify the GP, yeah? And then you need to notify your supervisor or your manager that they need to be booked for a COVID testing to confirm whether I'm positive or negative. Okay, so it needs to be done. So you have to do your care intervention will be, notify the GP, and then arrange a COVID testing to confirm whether I'm positive or negative of COVID symptoms. Okay, sorry, that's the fire alarm. So don't get ignore it. The next one will be, you also need you. So once you liaise with the GP, once you liaise with the GP, and then I will be given treatment for my cough. It's a bit too long for alarm. Sorry. That's it. Thank you. um, so highly likely the GP will prescribe me a cough mixture to to um, to treat my continuous cough, or I will be put into certain antibiotics. And then for the loose bowels, then I will be prescribed something like loperamide, or if it is intense, that it continuously or ongoing, then to replace the losses of electrolytes. So I won't have an electrolyte imbalance, then they might give me the Urolite or something. But highly likely if I'm already on antibiotics, and then that's it. Then they will isolate me for 10 to 14 days, depending on the public health guidelines. Okay. And then another care intervention is for those who are looking after me, whether I'm at home, in the hospital, or in a care home setting. They what you call set up a barrier nursing. Barrier nursing means you have to wear complete PPEs. Hi, Ian Quinton and Annalena Europa Blanza. Thank you for watching. So I hope you will learn something from this. Okay, so those are our care interventions. Okay, so make sure that whoever looks after me will do frequent hand washing, wear face mask, gloves, aprons, gowns, and then they will discard all those PPEs in a proper container. So if I am at home, if I am confined at home, obviously I have to isolate myself, and then all cutlery, spoon, fork, knife, um, cups, plates, and all that, it will be segregated. Yeah, it will be washed separately, and then if it should be washed in a hot temperature, so it will be properly disinfected. All my clothes will also be isolated, not isolated, segregated, put in create a basket inside a bedroom, so that everything that is used, and it will be washed separately also. So I will be isolated for about 10 to 14 days depending on the government guidelines. Okay, so and then make sure that I take my antibiotics. If it is confirmed positive or negative, whatever it is, then I'll just stay in my bedroom. And I think it will. The problem if you're at home and then you're using a shared facilities like toilets, whatever it is, then probably it would be a good idea to have like a commode maybe. But I know in a community how you're gonna do that. But yeah, so you just have to be creative, and especially if you live in a far-flung barangays or in areas where you have limited facilities and resources. So you just have to be creative. In our language, you call it paano ba yan? Gawan niyo na lang ng paraan kung paano niyo ma isolate yung isang tao, no? Para just to minimize the spread of infection po. Okay po yan. So, the outcome of your nursing care plan is that you will be able to contain the infection or stop or prevent the infection, the spread of infection. And obviously, for Rodolin to be treated for whatever condition it is, or to make sure that you will isolate to achieve isolation within a certain period of time to prevent cross infection and to be completely treated from COVID. So that is your desired outcome. So I hope so. Again, to summarize, to formulate the care plan, all you need to do is identify the needs. Then you set your objectives, specific and general. And then you identify the subjective and objective cues. Then you do your care interventions or we call it nursing action plans. And then I'd also identify your outcome, the result that you want to achieve for that person, for that client, for that patient, or for your resident. Okay, so I hope you learn something. And another example, you can also, if you like to suggest, to suggest, after this video, or during the video. If you have questions, feel free to write. Um, so thank you for watching. If you like this video, click like, subscribe, and share. Okay, and let's see. Hi, Jonaline Cadilla. Thank you for watching. May jacket ka na ba? Teacher SB, thank you. Tamsaktan. Anong tunog yan? It's a fire alarm po. Ayan. Kasi nag-check sila dito eh. It's a fire alarm. Thank you for watching. So those are the things, that this is how you make a care plan. No? So if you have any minor symptoms, simply lang, it's it's as simple as mathematical skills. No? But I think it's just a challenge, no, to make a care plan if you don't know the disease itself. Like for example, you heard something new, uh, you haven't got a clue what kind of diseases it is. So all you need to do is go back, ask Google about the signs and symptoms. So the secret in care planning is number one, you really have to know the signs and symptoms. So it will be easy for you to formulate the care interventions na tinatawag. But always refer, always go back to your GP, the impression or the diagnosis of the doctor, and then you work your way from there. Another tip to make an effective care plan is to mention, for example, if they prescribe certain medication, antibiotics, for example, it would be nice to include in the care plan that you will identify, or staff or yourself or a carer looking after that patient will identify the adverse effects of the medication that is being taken. For example, if I am prescribed antibiotic because of this COVID thing, symptoms, and then the adverse effect or the side effects of the medication I'm taking, whether I'm allergic to the medication, then you need to specify Rodaline is allergic to amoxicillin or allergic to this specific antibiotic. And what are the reactions of my body when I'm allergic to something? That I can vomit, I develop rashes on my skin, and that I will be having more loose stools. So those are the example now. And then if you are taking very high strength of antibiotic, of pain reliever, it's either I will get constipated or I will have gastrointestinal upsets, no, things like that, or it's either you will develop, for example, if you're having Butrans patches for the pain, you can also develop hallucination. You will be seeing things which are not there. For example, I have a patient that I used to have a patient that when she has patches, she get delirious. Delirium means like she's seeing things which are not real. For example, the flowers by the window will be mistaken as animals, or the bin by the door will be mistaken as a dog, or the people that passing by the window will be mistaken as burglars. Things like that. So yeah, these are adverse reactions, no? And other people, the common adverse reactions of medications in general terms, which I always see in the medicine book, are the ones like what you call this one, gastrointestinal upsets. These are common ones, and some of them are like confusion, um, vomiting, and just certain allergic reactions, no? So you really need to be, that's why it's really important for a person to know, all of us, you need to know your allergic reactions. It could either be medication, food, um, anything, objects, metals, jewelries, anything like that. Yeah, and it's very important that that you put that, for example, you never know when we're gonna be having accidents, incidents, or especially on your own, and nobody knows who you are. Nobody, and could you imagine? Example, you're riding in a bus or in any means of transportation. You don't have a wallet with you to identify who you are. You don't have other people is so funny. They put in a tattoo, they put allergic to something. So dapat parang okay ba yun, yung parang may ganun, or pwede ka namang magdala ng wallet mo or bag or whatever it is. Hi, Marisa and Jose Chavez. Thank you so much for watching. So we're discussing about care plan, yeah. So it's especially your blood type, yeah. It's very important because if, example, God forbids, you have an accident and you're in the middle of nowhere, you're in a different place, nobody knows you, you don't have next of kin, you don't have contact at the time when things happened, and you have severe blood loss, and nobody knows what type of blood you have. So I think it's very handy that you have something within you to identify that the your blood type is AB or AB or ABO or something like that, no. So it's very very helpful to the person looking after you, or to the hospital staff, or to anybody, um, that you have this kind of information, no? Kahit lagay mo na lang in a small piece of paper somewhere in your wallet, or in your, just to identify, no, allergic reactions, very very important. And if you can mention as well that you have this specific condition. For example, you have thyroid problem, or you had stroke, history of stroke. Just put in one piece of paper, in one night. It doesn't have to be a long version, no. Just say they're the very important ones. um, History, medical history of stroke, or sepsis, or tuberculosis, COPD, whatever it is that you have, you know, and then allergic to, so I can put myself, for example, allergic to dust and pollen, and then a previous flu vaccine, I have this intense reaction to it. And then I can put that I have this medical condition. So at least they know. Yeah, at least they know. And especially when you grow old, grow old, and I think it would be interesting while you're still young. You can put your wishes on how you want to be looked after. Actually, I'm planning to do that also. I have a, I have I haven't finished mine yet, but I've started it. On how to be looked after. But yeah, so if you have any question, feel free to ask. Um, I just finished my night shift. I'm sleepy now, but so I hope you have something to learn, and I will do more session like this because especially in my area about dementia. Now. There are 26 types of dementia, by the way, so it's a long list for you to know. Um, and it's very very helpful. You think the care home jobs, the hospital jobs, it sounds easy, but in reality it can be challenging. In reality it's not, because we are dealing with different type of people, with different type of diseases, with different type of illnesses, and that's where the real challenge begins, you know especially anything with fever. Whoever you are at home, especially watching at home, this is helpful for you, especially if you don't have any medical background at all. Anything with fever, always associated with infection. It could be anything. With cough and fever, highly likely with greenish sputum, like secretions, yung it could be chest infection, especially if they get confused. Um, with a urine infection, you will check the urine, but obviously you have to confirm it using the urine culture and sensitivity test, or a dipstick. No, if there's presence of leukocytes and the blood in a urine dipstick. One day I will teach you how to check a urine using a dipstick. Yeah, I'll do live for that, but of course I need a urine sample. But or it may not be just the water, maybe, and they just pretend, you know. So I will show you how to check and identify whether you got a urine infection or not. Yeah, by using the dipstick strip, and then and what it means, if the color changes, what it means, and how to identify so you can notify your doctor, and then you can straight away you can get an antibiotic to treat it. But the secret in treating any type of infection is by drinking at least 8 to 10 glasses of pure water in 24 hours. Okay, so any type, lalo na pag it's nice. This warm water first thing in the morning. It's very helpful din po, no? It can cleanse your gut, your intestine, your bowel, your ano ba, yung mga kalamnan natin, no? And it will enhance a good flow of circulation as well, of the blood circulation in our body. So that will prevent migraine, headache, and also it cleanses, no? It cleanses our body talaga. So I hope you learned something today. And it's not much, but yeah, I'm I'm just happy to catch up, no? I know we haven't shared so much about. No, I thought this is just a bonus kwentuhan. No? I haven't shared much about what I get during Christmas because I've been working night shift, no? Make shifts and then night shifts, especially this week. So what I got in the SPA, what I got during my, I saw your video about the the Christmas sharing. That was fun. So this is my Christmas gift from because we exchange gift. Yeah, we exchange gift. Hi Marilu Galing. Thank you for joining. Ayan. Merry Christmas and Happy New Year belated. Replay mo lang ga ha because this is a topic is about how to make a care plan. So this is my teacher SPL. I think you're gonna like this. It's a set, makeup kit set. So I got this. The one who pick up my name is our chef. So thank you Nigel for this, and of course my staff Marilla bought this for me. Thank you. So the different sets of makeup, so which I will be using, but obviously I'm not. I only use lipstick actually and a bit of shades, but it's okay. And then I also got a very nice toothbrush that's really like an electric one, and I got also chocolates from Antissini, and I got this special set of earrings. Yeah, it's just cute little ones. Um, I got you. Yay! I got certain earrings. I'll be using this. And thanks, Janelle. And a cup and saucer as well that I used for. And then also, yeah, from some of our residents. And then we bought some socks and distributed it to the staff. It's quite fun. It's not a lot, but it's the thought that counts, isn't it? And yeah, so how about you? What did you get? Ayan. Wow. Yeah, it's really cute. I wish I can get you one also. You like it, Inday? May bukas na ako. Mag-LS na to. Oh, what happened to you? Yung panalo ninyo, wait lang, sarado pa ang tindahan. Ayan, okay. What did you get for Christmas, Inday? Hi, Anna, Roxana. Thank you for watching. How's baby? Ayan. And also one of my staff has given me this wonderful toothbrush and then the eyelashes thing. So it's quite fun. But obviously, as I said, it's the thought that count. So yeah. feel free to share what you have um, received and what did you get for Christmas, Teacher SB? I saw a lot of gifts. I saw a lot of gifts that you have on the video. How about you, Marilo Galing? And sino yung isa? Jonalyn Codilla. Ayan. Kanina tindahan yung sarado, Day? Ayan. So, it's time now is 30 minutes and 45 seconds. So yun, update dito sa UK. Yeah, the water is too cold. It's getting winter now. I don't know when it will gonna be snowing, and I think we will be on lockdown again. So it's quite boring. It's tiring. It's frustrating. But we want to start 2021. We're being hopeful and optimistic that things will improve soon. So at the moment, we're just continue carry on, just doing what we're doing, looking after, working day and night, and and yeah, just continue waiting what will happen next. Okay, so I hope you are all well, Luzon, Visayas, and Mindanao. I think my voice starts to get lost now. I've been working continuously now for how many days, so that's why you didn't see me much in YouTube, but I'll try to catch up with you. Okay. And by the way, those who want still, I'm still doing my simplified drop shipping now. So for those who haven't signed up yet, I hope you do catch up. And because there's a lot of surprises in store for you. Okay, it's free for now, and then later on, you know, you will be invited to attend the training, and hopefully you know, you will really benefit from it. Okay, so thank you so much for joining me. I will just stay for another few minutes and then I'll be signing off. I need to sleep now because I'll be working again tonight and I'll still have a meeting at 2 o'clock. So, yeah, I wish you all the best. Happy New Year, and I hope we will be catching up soon. Okay, thank you so much uh, for sharing your time and following me here in Facebook and YouTube. And rest assured, there will be more amazing topic in store for you. I'm just trying to balance between my work now and educating the world with what I know and what I think can be helpful to humanity. Okay, so God bless everybody. Thank you so much for watching. This is Rodrin TV live from UK. And if you like my channel, please hit the like button, subscribe, and share. Thank you. Have a good day, everyone. God bless. I love you all. Bye.